Hi, everybody. I am Mark Graven. I am the VP of Improvement and Innovation Services at KaiNexus, and I'm very happy to welcome you to today's webinar, which I hope will be of great interest not only to healthcare professionals, but to anybody who potentially can be a patient or the loved one of a hospital patient. Today's topic, teaming with patients to improve safety, is something that we all think is really important at KaiNexus, and we're really excited to bring this to you today. We have three co-presenters, and I will introduce our first co-presenter in a second after we touch on a few of the logistics. So we have three presenters today. And I'm going to start off, I'd like to introduce and then hand things over in a second to Laura Townsend. And Laura will introduce Elise and Carol and talk about some of their collaboration here. I first met Laura. She's the co-founder and president of the Louise H. Batz Patient Safety Foundation. I first met Laura in 2012 when I was living in San Antonio. And Laura's family is from the San Antonio area, and Laura's going to tell the story of her mother, Louise Batz, and what led to the unfortunate circumstances that led to the founding of the foundation. But I greatly admire the work that Laura and her family have done to help encourage collaboration and teamwork within healthcare in the name of protecting and helping other patients out there. So Laura, I will go ahead and hand things over to you. Thank you again for being here today to present for us.
Well, thank you, Mark, so much for having us here today. It's a real honor, and Mark has been with us for several years now, and I'm proud to have him as a member of our board. And I just thank you so much for everything that you do. And I want to introduce. I'm going to share my mom's story, and then I'm also after that what we've been doing since then, and talking to you about the vision and mission of the Louise Batz Patient Safety Foundation. And Elise Matocha will be speaking today, and she is with Seton Healthcare Family. She's a bone and joint coordinator there, and she's been using our Batz guides. And then Dr. Wratten, who has been with us since the very beginning, almost 9 years ago, when my mom passed away. She was the CMO at Baptist Health System at the time where my mother was, and has really gone on this journey with us. And she is absolutely amazing. So I can't wait for you guys to hear these ladies after I speak. But it was a little over 8 years ago in April, and my mom, Louise Batz, and Mark, if you want to move the slide to the front of the, a couple of slides in front where it talks about our story, and it has a picture of my mom.
Here we go.
Yeah, and one more slide to share our story would be great. Yes, there's the mission right there. Thank you so much. So that is my mom, Louise Batz, right there. And the two little girls in the picture are on the left is my daughter, Ella Townsend, and my other little one, Mary Louise Townsend. And Ella is going to be 13 years old next week, and Mary Louise will be 10 this year. I can't believe how much they have grown up. And that was the last picture, the last birthday that my mom celebrated. In April of that year of 2009, my mom decided to have knee surgery, and she needed to have total knee replacement. And she'd really done her research, and we grew up in the medical community of San Antonio. We have 5 doctors in our family, and so we really felt like we knew how to navigate the system, and she was so prepared for it. And everybody told us this was going to be no big deal, that she was going to be in and out in 3 days, and then no problem. So they did this every day, and so we really had a false sense of security going in. And my mom had, we went to the pre-op that morning, and it was just my aunt and Joanne and my dad and myself. We were the 3 non-doctors, but the rest of them were going to come on the weekend. And she was great. She had never had surgery until the last time my mom had been in the hospital was 35 years before that, when she'd had me. So she was really a healthy, strong woman. And she went back for the surgery, and I think as a family and a patient, you feel that if you just make it to the surgery, everything's going to be okay. So after about an hour and a half of waiting, the doctor came out and said, gosh, you know, she did so great. She has a beautiful new knee. I'm so pleased with how everything went. And, you know, you just have this huge sense of relief that just gone off your shoulders. And you're just like, whew, okay, this is smooth sailing from here on out. So they moved my mom to the orthopedic unit, and she was getting 2 milligrams of morphine on a PCA pump. And around 6 o'clock that night, my mom started to feel a little nauseated from the creamy soup that they had given her. So they gave her a drug called Visceral to help her with that. And then around 7:30 or 8 that night, I went and grabbed Ella, my oldest, and we took balloons and flowers and to the hospital, and so she could see my mom. And I was so happy that my mom could see her and that Ella could see her. And she always had this smile on her face. I know that she wasn't comfortable, but she just had this beautiful smile on her face like she does in that picture, and was just so happy to see her. And then I took Ella home, and I came back, and it was my mom and my dad and myself and my Aunt Joanne, and we were visiting with the nurse, and she was wonderful. It was around 10:30, and she probably spent 30 minutes with her, just asking her all kinds of questions, and how the rest of the night looked for my mom. And, you know, they told us that at midnight, my mom was scheduled to get the morphine again, the Visceral, and then a narcotic called Demerol. And we were like, wow, that kind of took us back. We're like, well, that seems like a lot of medication for someone who's never taken anything more than Advil. And they asked my mom, like, what type of pain level my mom was in between 1 and 10. And my mom was like, I have no idea how to even rate that. I don't know. I don't have a basis. I don't know. And they said, well, do you feel like you're having a baby? And she's like, oh, gosh, no, this is no big deal. This is nothing like that. So we all made the decision that my mom was only supposed to have the morphine if she needed it, and she did not need the Visceral or the Demerol at all. And then the nurse told us to please go home because my mom needed to have her rest. And so I gave my mom a big kiss. I told her how much I loved her, and I told her that I would see her in the morning. And my dad and I went home, and, you know, he was so relieved too. I mean, you know, it was really, honestly, the first time that my dad had probably been in the house by himself without her in 45 years. And so we went to bed that night, and around 3 o'clock that morning, we got a phone call from the hospital saying that my mom was having trouble breathing, and that if she could please come, if we could please hurry and get to the hospital. And so I started to panic. I called my Uncle Charlie, who's an OB-GYN in San Antonio, and he was like, don't worry, it's going to be okay. They probably just moved her to the telemetry floor. Then we went, I called my brother in Dallas, who's a radiologist, and he started to panic because he was like, did she have a pulmonary embolism or what happened? And then I got to the hospital, and I saw a security guard outside my mom's door. And so I started running. I left my dad behind, and I realized at that point, oh my God, I looked in the room, and I thought my mom was already dead, because she was just laying lifeless on the bed, and they were only doing a handheld oxygen thing to help her. And I didn't understand what had happened. And you realize why they have a security guard outside the door, because you feel like 20,000 knives have just gone through your body. And it turned out that they had given my mom the morphine and the Demerol and the Visceral at midnight, and they had no monitoring on her. And she went into respiratory depression and suffered an oxide brain injury. It did not take us long to realize that my mom had suffered a preventable medical error. And we did not know. We'd never heard that term. I mean, we'd grown up in the medical community, and we'd never ever talked about it as a family. And it was so shocking to hear that. And my mom was on life support for 11 days after that. And during that time, I did a lot of research, wondering, are we the most unlucky people in the world, or does this happen to other people? And we were just so shocked to see that over 200,000 people a year die from preventable medical error, making it the third leading cause of death in this country behind heart disease and cancer. And how did that happen? How did we not know this? How is this problem such a huge problem? And we never talked about this as a family, a medical family. And 11 days later, on April 26th, we had to take my mom off life support, and it was a horrible experience. And it's not like it is in the movies, that's for sure. It's a terrible, horrible thing. And we wrote, I said goodbye to my mom, and that night, after my mom passed away, we wrote the mission for the Louise H. Batz Patient Safety Foundation, which is what you see here on the screen. We weren't going to let other families experience the pain that we went through. We were going to try to help as many families and patients and nurses and doctors not to experience the pain that we went through as a family. And my mom's legacy wasn't going to end that night. That's not the way her life was going to end. And so from that moment and on this journey for the past, it's been an incredible journey, the past 8 years. And what we've done and what we've tried to accomplish and the people that have helped us and the team that we've created, it's really amazing. And if we want to move to the next slide, what we've done, what we did from this point has been really, really extraordinary. At first, when I look at myself, I think if I could just have 6 hours back, what I wish I could have known, what I wish I could have done to save my mom's life. And that's really my driving force every single day. I sat with the nurse. I asked 1,000 questions a day. I just didn't get lucky and asked the right one. And so we had to sit down and figure out, like, why did this happen? And so really all the San Antonio hospitals really rallied around us and around our family. And we came up with the 3 reasons that we felt were the reasons that my mom died that day. What was that root cause analysis? And we always say one was a lack of teamwork. We always said that we had a great family, great patient, great nurse, great doctor, but great players don't make a great team. And we did not work well as a team that day. And the second was a lack of knowledge. I always say I asked 1,000 questions. I didn't get lucky and asked the right one. And that's so true. I mean, it's just nothing that I asked really made any effective decision in her health care that day. And it's heartbreaking looking back at that. The third thing was the lack of technology. I always said that they put my mom in a car going 200 miles per hour without a seatbelt and a helmet and just said, good luck. They gave her drugs that she had never taken before, narcotics that she'd never taken before, that you don't know how someone's going to react to, and didn't have any life-saving monitoring on her at all, anything. And they sent us home as well. So it was just a disaster waiting to happen. And so when I think about if I just had the right questions to ask, my mom would be alive today. And that's really what we've started to do. And we've built all these guides since that point. And it's been amazing. We have an adult guide that we've built for the Batz guide. We have it in Spanish, English, and Dutch. We have a pediatric guide that we've developed. We have 2 pediatric transplant guides that we have developed. We have an app. If we go to the next slide, you can see that also we've developed an app that you can use that on your Android devices, your iPad, your iPhone. It's really great. It's free for anybody to download. We've got wonderful partnerships that we are now developing. If you go through the next slides, I can show you that these wonderful. This shows you just a list of where we so far have distributed the Batz guide and our partners. That it's not just what's so neat is it's not just me going out there to distribute these guides. We have these wonderful partners and companies that go out to conferences and do this for us, and they, believe in what we're doing. It's really amazing. And if you go to the next slide, you can see that we've also developed, and we've been working with the Head Start program and our Empower team, which is a collaboration from the University of Texas School of Pharmacy and the Head Start program to create tools in Spanish and English for 3,000 families in San Antonio that are part of this program to help them in their healthcare, that you and your health. It's really about improving, our health literacy, and how do we have the right questions to ask our healthcare providers, and how do we, these tools really create that bridge for families and patients to become part of the team. And if you go through just quickly on the next slides, we're also developing, we've been working with the pediatric transplant, which we've already have that developed, which is wonderful. And then on the next slide, you'll see that we are working with Susan G. Komen to develop a breast cancer guide. And we're also developing one for heart patients. And we are also developing one for NICU babies that should all be ready to go, hopefully in the next 6 to 12 months. So it's been really exciting, the journey. We find that everybody needs one for their specialty, it seems like, and then we keep getting calls for that. But it's been really amazing. And these next 2 ladies that are going to talk to you are amazing. Elise has been at Seton, and they've been using our Batz guide in their joint unit for the past few years, and I can't wait for you to hear how that implementation has been working. And then Dr. Wratten will be speaking after that, and she is just been, just been amazing for us, and one of our heroes at the Batz Foundation, and she's on our medical advisory board as well. And just about the journey, but the journey that the healthcare organization goes on to implement these guides, and the importance and the culture change and what it takes. And so thank you so much, and I'm going to pass the baton to Elise, and then I'll cycle back at the end.
Okay, thank you, Laura. Before I talk, I just want to give an overview of where I work, the organization that I work for, and it's Seton Healthcare Family of Hospitals. It's a not-for-profit organization. It's the leading provider of healthcare services in Central Texas, and we serve an 11-county population of 1.9 million. We are the region's largest community service organization, and Seton contributed more than $419 million in charity care last year. We are in partnership with the University of Texas System Board of Regents. We have a new medical school, and the Dell Medical School at the University of Texas at Austin. And our parent company is Ascension Health. We have 5 major medical centers. Seton Medical Center Austin is one of those, and that's the one that I work at. We have a couple of community hospitals, 3 rural hospitals, and an inpatient mental health hospital. And we have primary care clinics for the uninsured. And we're proud to be a magnet hospital. And my particular unit, which is orthopedic, we are certified in disease-specific care for joint replacement and spinal surgeries. And you can advance the slide. Oh, I think it needs to go a little further. Advance some more, I'm sorry. It's for how we introduce our guide. So we have a preoperative class. It's our bone and joint class, and we have total joint surgeries that attend, patients having those surgeries. And it's approximately 1 to 6 weeks prior to the surgery, and we prefer it be anywhere from 4 to 6 weeks that they come in ahead of time. And our class is focused on prevention of complications and patient safety. We're preparing the patients for what they need to know, what they need to do to prepare for the surgery, what to expect when they're in the hospital, and preparing at home and making sure that they're going home to a safe environment. And we also go over their rehab expectations. So we want them coming in as healthy as possible. We want them to stay healthy while they're here, and then, of course, go home healthy. And so we explain that we, as their caregivers, we have a big role to play in making sure that all of that happens, but that they also play a role. And a big part of that role is being their own advocate, feeling free to speak up and verbalizing to the staff, the surgeons, the physicians working with them, any concerns that they have. We ask them to have a designated person come with them and attend the class. We call it their co-pilot. And again, we want them all feeling like they can speak up. And in the class, we give a brief overview of the guide itself, and we talk about the Batz mission and story. We don't have a whole lot of time to do that because we've got a lot of information crammed in that class, but it's basically like a show and tell. We show the guide. We explain the different sections of the guide. We do tell them that there is an app available and give them that information. And we're proud to say that Seton is partnering with the Batz Foundation to encourage patients to be their own advocates. We want them to feel free to speak up. We explain that the guide tells them what to watch out for. It's what to be aware of while they're in a hospital setting, and that it also can be used as an organizer of their health information. So, it's a workbook for them as well. They can write new medications, concerns, questions in there. So it's a tool that's educating them, while at the same time it's providing an avenue to actually engage them in their care as well. And what we found is that it really sets the tone in the class from the start for transparency. regarding the care and asking them to take an active role right then. You can advance, please. And so we had some initial concerns. This was a few years back, and initially we were somewhat leery because we thought that it would create more suspicions instead of alleviating them. We thought that it might increase the nurse's time at the bedside because of that. You know, would be more suspicious of the care, therefore they're asking a lot more questions. And again, it was a few years ago where the culture wasn't quite as transparent, I think, as it is today. We thought that it would make them more trusting, and that the staff would then be more hesitant. We didn't want them to be defensive. And then we thought that maybe the book had too much information. Maybe it was a little bit too big and wieldy, but we wanted to try it with our patients. What we found, and you can advance the slides, please, is that it was quite the opposite. The patients and the families are really actually less anxious, and they are encouraged not only to speak up and be their own advocate, but to actively participate and engage in their care. And we see that in the class as we're explaining the purpose of the guide. We can see them just visually relaxing. It's in their body language. They're shaking their heads yes in agreement as you're talking about it. It's all about being real and honest and planning ahead. And I think they see that. It helps them to see that. The patients are more knowledgeable about their care. This is the evolving culture of healthcare now. There's many things that we're doing to help them to be more knowledgeable and to participate more. We have bedside reporting. We have nurse leader rounding daily. We have a care board that's right in front of their bed that we review. The staff reviews with them every shift, as well as a care pathway that's laminated on the wall that we take down and review with the patient. All of that is reinforcing patient safety and advocacy. And the Batz guide just goes hand in hand with all of that. It's a tool that helps in that overall transparency goal. The foundation streamlined the guide based on our feedback, and that was from our patients. It was from meeting with us frequently. We had a patient in particular that was a CEO of a large company, and he thought the guide was great. He shared his information. He loved it, but he also told us how he thought we could improve it. And he did feel like it could be streamlined further. And Laura and the foundation, they made all the changes that he recommended. They were very easy. Laura is very easy and very accommodating and eager to work with us. She's awesome. She's always seeking feedback for any ways for improvements and suggestions, and it just makes it very easy on us. And then the guide is free, and we tell the patients that from the beginning. We don't want them to feel like we're trying to sell them anything. We just want them to know that, we want to do this to help them. And I think that speaks volumes right there, that we're really just trying to educate and help them to have the best outcomes. You can advance the slide, please. And then our weakness is that we really needed to do more data collection. It's subjective feedback only. So based on what our patients tell us, about a quarter to a half use the book as a workbook to organize their visits to their, physician's offices, to write down new medications, questions to their doctors while they're here. Most of our patients get very positive feedback that it's helpful information, and it made them feel more comfortable knowing that we're encouraging them to speak up, and that we know that they are informed and that they're watching us, and that we're okay with that. I think that's really says a lot. It is important to educate the staff. We did educate in the beginning. Our new orientees and our residents that come through our class, they attend our class, and they are also given a booklet. They watch us and tell, what we're telling the patients in terms of what the book is all about. So we want them to know right off of the bat as well. And that's really all I have. Dr. Wratten is speaking next, and she was the one that introduced us to Laura and to the Batz Foundation, and she really was the driving force in getting us to see that this was something that we really needed to do for our patients, and we appreciate her for that. And I'm going to hand off to Dr. Wratten now.
Good morning. Thank you for the opportunity. Mark, could you advance to the next slide, please? So, as Laura said, I was the Chief Medical Officer at the Baptist Health System when Laura's mother died, and I have been working with her off and on through that time to get this concept off the ground. I've experienced myself as a new healthcare provider early when I was in medical school, and then when I was in my residency, serious family illnesses and then death, and was very frustrated as a family member, even though I was in the healthcare industry, with the resistance of the healthcare industry to really bringing the patient voice into being members of the healthcare team. So I've been happy to collaborate with Laura on to help develop and implement the Batz guide that facilitates communication within the healthcare team and the recognition that patients are integral members of the team. Healthcare is traditionally paternalistic, and that structure of paternalism can't keep patients safe. Patient safety requires that patients to recognize and accept their responsibility to be actively involved in all the details and aspects of their care, and for providers to also recognize that. If you can advance to the next slide, please. So this is a culture shift that we're trying to implement, and culture change is not easy or quick. It takes time, and it takes an ongoing commitment. I was at Seton for probably almost a year trying to understand the culture and the staff before we really had enough traction to implement the guide. And I think Elise will testify that it took a year or two to really get the staff accepting and the patients accepting, and to really learn on the ground, boots on the ground, how to develop that relationship with the patients. And orienting new staff and now orienting residents is another innovation. And how do you really not only change the culture but sustain that change? So what are some of the critical steps that I've learned and that we've learned in doing this work? Number one, you have to create a why with a real patient story. For the Baptist Health System, that story was Laura's mother's story, but each institution really needs to have their own why, and it needs to be a why that the leadership of the organization understands. They need to support this change, and they need to facilitate the change. The leadership support and facilitation is critical, but in addition, there must be champions, boots on the ground, in the units, in the individual units or service areas, that believe in the importance of patients and their caregivers as members of the healthcare team, who actually lead the transformation on the unit. And Elise has been that for the Seton Healthcare family, the orthopedic unit, but for the development of every one of the guides that Laura team has developed, it has been those champions that have worked to bring those guides to life. Then you need to develop a process for introducing the tools in a reliable way, with patient and staff training on the use of those tools. The use of the tool has to be part of the workflow for the team. Top-down implementation will not work or be sustainable. If it's an extra thing for the team to do on top of their other work, it's going to have a hard time gaining traction and a very hard time being sustained. So having that, and that's one of the reasons why we enjoy working with Mark, because the idea of using lean process development where the use of the tool is really part of the workflow of the team is so important. There need to be organizational goals around patient engagement that hold the leadership and the staff accountable, and measures for improvement and to reinforce the desired behaviors around the use of the tool are really important. A daily management system where there are some leading metrics that really help assure that the patient voice is being incorporated into the workflow and being incorporated into the goals for the unit is really critical. And then what is the ongoing process to address staff turnover that keeps this tool part of the workflow and part of the organizational goals? Mark, could you advance to the next slide, please?
Yep.
So some of the other sustainability things, one of the things that Laura's team has developed is the Louise Angel Hero Award. Baptist and other organizations have developed little rewards within the organization to help reinforce amongst the staff the importance. So the Louise Angel Hero Award is an award given to staff who've really been heroes in bringing the patient voice into it. But we have testimonials on these next couple of slides from different staff members and organizations that we're working with that really talk about how important the tool is in keeping patients safe. So Emily Burgess says, keeping patient safety is a top priority of mine every day. By partnering with the Batz Foundation, we're able to change the landscape of transplant safety and will continue to positively impact patient lives. Nelson Tuazon, who is the Chief Medical Officer for the Baptist Health System and now is at the University Health System in San Antonio, says the Batz Guide provides the opportunity for our nurses to have a dialogue with our patients, to talk about what's meaningful and relevant for patients and their loved ones as they go through the transitions and care between the hospital and their physicians and when they go home. Next slide, please. And then two other ones. In the 24 years of nursing, I've seen firsthand that patients and their caregivers can be the most powerful component of safe care. I've been so honored to play a small part in the pioneering of the work of the Louise Batz Foundation as they continue to make strides in creating practical tools that empower healthcare consumers and to be advocates for themselves. And finally, the Batz Guide is a great resource tool that allows patients and family members to become more involved with the care that we are providing. I think this is kind of a testimony to, no healthcare provider goes into healthcare to hurt people. They are mission-driven people, and these tools help them fulfill their own mission in addition to what it does for patients. It does the same for providers. I think that's the end of our presentation, and we're happy to take questions.
Thank you, Carol and Elise, for sharing your stories too. I think it's so important to hear. We start with my mom's story, and we started with the tragedy. It's a tragic story, but these stories that you hear from Elise and Kara, they're the ones that it's the hope, and that's what my mom was so full of. She was so full of hope and love and faith, and she always told me that not to get if I was frustrated about a situation or upset about something or I didn't think I could get it done. She's like, don't ever think that way. Don't ever, let's just, get up, brush it off, and let's do it. We'll work it out together. We can always do things if we work it out together, and that's really what we've been doing over the past 8 years. With these two and with Mark and everybody that's joined our team. And thank you for having us here. And if anybody's ever interested in using the Batz Guides, or if they want them, to please reach out. We have our information on our slides right here in my email. contact information that, we're here for you. I mean, because we know that this is where we need to go in healthcare, and we need to change the culture, and we need to bring families and patients to become part of the team. And I think once we do that, we will get to zero. We will get to zero preventable medical error. And thank you, Mark, so much for having us here today. I really, really appreciate it.
Yeah, well, thank you, Laura, and thanks, Elise and Carol. I encourage people, go ahead and continue submitting questions through the question box in the GoToWebinar control panel. And before we start the Q&A period, have a couple of quick announcements. For one, Laura mentioned that I've been honored to be on the board of the foundation for a couple of years, and I try to support the foundation in different ways. And one way we're doing that is through a book and now an audio book called Practicing Lean. We have chapters by myself and 15 other authors who each contributed a chapter with some of their lessons learned and reflections. Paul Akers, who's quite well known in the Lean community. Two people you might recognize if you are regular attendees on the KaiNexus webinars, Harry Kenworthy and Michael Lombard, who have both presented webinars here through KaiNexus before. The book is almost 300 pages, and all of the proceeds, shy of any sort of fees from Amazon or anybody who is selling this, are being donated to the foundation. So I would encourage people to go to www.practicinglean.com if you're interested in the book or the new audiobook. We're honored to try to help the foundation this way. Our next webinar is going to be on September 21st. We're going to have co-presenters again on the topic of effective collaboration across organizations and across industries. So today's theme, of course, was collaboration, patients, families, caregivers. We're going to continue the collaboration theme. We love collaboration at KaiNexus. So we're going to be joined by Teresa Hay McMahon, who is the Executive Director of the Iowa Lean Consortium, an organization, of course, in the state of Iowa that encourages a lot of learning and collaboration and sharing within the state and some neighboring states, actually. And she's going to be joined by Stephanie Hill, who is the Corporate Continuous Improvement Manager at Craig Tool Company. So they have a lot of great ideas to share about how we can get more collaboration. I hope people, especially from healthcare who are attending here, who will join us on September 21st, can talk about collaborating and sharing across health systems within a community or within a state in the name of protecting patients. So if you want to register for that, you can go to kainexus.com/webinars. Before that, September 12th, Greg Jacobson, co-founder and CEO of KaiNexus, will be joining me for our next Ask Us Anything. It's a 30-minute video broadcast where we answer questions from KaiNexus customers and our broader community. So you can register for that. You can submit questions, again, kainexus.com/webinars, and you can find our past episodes on the KaiNexus YouTube channel. We have a few other resources. We have our growing library of recorded webinars, these webinars on demand, and we have our blog at blog.kainexus.com. And if you see here where it says the improvement blog, and then there's also a customer blog. If you are listening because you're a KaiNexus customer, you can check out that customer blog. I mean, it's open to the public, but that talks about product features and things like that that are more of interest to customers. And then finally, I want to mention our KaiNexus podcast series. The audio of today's webinar, along with our other webinars, interviews, audiobook versions of blog posts, all kinds of content is there. You can go to kainexus.com/podcast. You can find us in iTunes and all the other places you might normally subscribe to podcasts. And then again, we encourage you to check out louisebatz.org or to email Laura if you have follow-up questions, and especially if you want to talk to Laura and or Elise and Carol about how you might be able to roll out and introduce the Batz guides into your organization, or if you're coming at this from the standpoint of an employer or a community member, you may want to help sponsor some of these efforts in your community for the benefit of your employees and their families and your community as a whole. So again, want to thank our presenters and everyone for being here today. We've got some questions if the ladies are ready. Maybe it's, I don't know, it's not directed at anyone in particular. Maybe all of you might want to touch on this. Why do you think there is still so little public awareness about the scope of this problem with deaths and harm that are caused by preventable medical error? Who a volunteer who might like to touch on that first?
We probably all have a different view.
Laura, would you like to?
I'll go from the patient side, and just my thought. Sometimes I feel like can sort of be the white elephant in the room. You know, it's something that, you know, there's not a lot of, I don't think there yet, maybe there's not a ton of transparency and awareness on this issue. And it's hard because, you know, doctors and nurses, like we have 5 doctors in our family. Doctors and nurses are heroes. They save our lives every single day. What they do is miraculous. So it's also something that, you know, where we come at a stance is that it's very positive that we want to work together with you and to help make and to have, and if we do catch a mistake, it's a good catch. It's not a mistake, it's a good catch. And our guides do that, right? I mean, my dad was in the hospital several times after my mom passed away, and every single time he had a medication error, but we caught it. And that's the most important thing, and we could fix it, and it's a real positive way. It's not anything, you know, it didn't end up like my mom, right? And so I think it's a real, I think it's just a very sensitive, touchy issue. And I'll let Carol and Elise, because I'm sure they have a different viewpoint coming from the medical side. But I really feel like it's so important that we do create awareness in this and kind of just bring forth to light. And it's not to be anything that's negative to the healthcare team or the healthcare doctors and nurses. It's like, how can we help you? Because we don't want this to happen. And I think that's sort of we have to make sure that we present it in that way. But I'll let Carol and Elise, I think, maybe might have a side from the healthcare side, what their thoughts are.
Well, this is Carol. I think that if there are, I think there are a lot of reasons why errors occur, but I think one of the big things has to do with it has to do with the culture of medicine and medical education. And, you know, physicians and other providers go into healthcare to help people, and being humble enough to recognize that you don't always do that well, and being open to soliciting help from patients is difficult for providers, but also for patients. I think it's difficult when you're vulnerable as a patient to question doctors. And in hospitals, when errors occur, unfortunately, there's been a lot of shaming. There's been real active suppression of error by the healthcare community, and some of that on the part of providers is just a defensive mechanism because they're not willing and able to be vulnerable. Some of it is related to fear of job loss and loss of reputation. And again, this is where I think partnering with patients takes some of that burden away and helps keep us safer. But I think the willingness to acknowledge that the error is really endemic within the healthcare community.
Yeah. Elise, from your perspective as a nurse or as a manager, leader in healthcare, what do you think?
I totally agree with Dr. Wratten. I do think she's right on that. One thing is, the positive thing is that the culture is changing, and I see it amongst my peers, the surgeons that we work with. We have hospital-wide safety briefings that, you know, we go through each day, and we talk about near misses and what could have been done, you know, to prevent that. So there's just, I've just seen it. I've been in nursing for a long time, and I've seen a big culture change just in the last few years. So it's going the right direction.
And then it's just really about getting that message out to the consumer. You know, I think that's kind of where we are too. That's what we're trying to improve.
Talking about this, I mean, you know, when I got into healthcare 12 years ago, you know, from a background in engineering, it's kind of part of the engineering mindset to think about what could go wrong, because that's a positive act, because then we can try to figure out how to prevent problems from occurring, and focusing on systems instead of telling people to be careful. When I got into healthcare, it seems like there was there's more tendency to blame somebody when something goes wrong, and I don't know if superstition is the right word, but I had some people tell me quite literally, like, well, you know, we don't like to talk about these things, as if not talking about it is a good strategy for preventing error. So, you know, I think when we see in the news, you know, stories of medical error, unfortunately, there's too much blaming that happens in society. You know, the implication is that there was a bad doctor, there's bad nurses, and you know, one reason I've been so drawn to Laura's work and the Batz Foundation's work is that it comes from a very blame-free perspective, a recognition that we have great people in healthcare who are often you know, thrown into a bad situation of having to work within bad systems, and you know, I certainly appreciate the perspective that you know, this is preventable. If we were going to rely on, you know, people being perfect and superhuman, I wouldn't have much hope. But when we improve communication, have better systems, we have a fighting chance. Does someone else have a comment on that?
Right. I always say that, you know, my mom's death didn't lie on the shoulders of one. It was the system that failed everyone. The system failed everyone, and it wasn't one individual person, and it should never, ever, you know, be thought of that way. And I think what's important, and why I do share my story, and I keep sharing my story, it's not an easy story to share. It's a sad story. But if we don't share the stories of how something went wrong, then we'll never be able to fix it. We can't always focus on the yay stories that somebody did that's amazing, which we should celebrate those too, but we should also celebrate these stories as well, because then these stories, these sad stories, turn into hopeful stories, and they turn into change. And that's why, you know, I keep doing it, and I'll probably never not cry sharing the story, but I know that every time I do that, hopefully we'll be saving somebody's life, and my mom will be saving somebody's life. And that's why we have to keep getting out there and creating that awareness so people are prepared, and that we can all work together as a team. I mean, it's really, I always say that doctors and nurses, you're almost superheroes, but you're still human, you know? So, you know, there's going to be, there's just always that room to make an error on everyone's part.
Yeah, and it's those same good people who contribute to the miracles and the lives saved on one day, and then the next day there could be some sort of error. It doesn't mean they're suddenly a bad
person, right? Person. No.
Bad provider.
No, but have relied in the past in healthcare on the actions of people as if the people controlled, as if we're always at the top of our game. And we can work harder and be more perfect. And really what we need is better systems, the way engineering does. And that's why what you bring to the table, Mark, is so important, because we have to create better systems that makes it possible for really talented people to do good work. And including the patient in the very beginning helps us create those better systems.
Yes. Yeah, I think we're definitely in agreement on that. There's a question directed toward Elise, but you know, can you talk a little bit more on the slide where you said there was concern about more time at the bedside? If studies show that more time at the bedside leads to better outcomes and patient satisfaction, was it really more a concern about that one more thing? Was it really more of a concern about not having time to engage patients this way?
I think at the time frame that we were beginning this, it was probably a little bit of fear about, you know, how do I handle all these questions? I mean, now that's not not the issue. We really encouraged them to, but I think at the time frame there was probably not that same level of transparency. And then in addition, I think they just it was the time frame of feeling like I'm not. These are good questions. And I need to be able to have the time to sit down and really engage, with the family and with the patient, and I'm not going to be able to do that. So I think there was a lot of concern about that. So probably a little bit of both.
I always, one of the things though is that, I always say that I spent 20 minutes with our nurse, at least, and we asked so many different questions. And the real tragedy is that not one question I asked that day was in the Batz guide. So not one question I asked that day really mattered. And that is the saddest thing of all, because if I had had that Batz guide, first of all, I probably would have gotten to page 10 and realized that my mom had undiagnosed sleep apnea, the trajectory of her care would be completely different, and, we wouldn't be here today. But, none of the questions that I asked were really targeted to, her health that day, and what could really make a difference. And I didn't know to ask what my machines were hooked up to my mom, because I thought the machines that were hooked up to her were life-saving machines, but they were just really PCA monitors. So really I wasted 20 minutes of the nurse's time. And so really the guide is supposed to be a tool to have good, efficient communication with the family and the patient, good quality communication, not just what am I going to eat for dinner today? Or just things that don't necessarily matter. And the nurse doesn't really have too much time to take care of. It's really life-saving questions that are so important. And so that's what the guide is and its use is for. And I think that and when Elise says that when they encourage it now, they realize that actually, no, these are good questions to ask. And this really helps us do our job quicker and maybe more efficient. So.
Yeah, well, I think you raised a really you raised a great point there, Laura, that maybe it's fair to say not all time at the bedside with patients or loved ones is created equal. That to me the guidebook it goes beyond just an admonition to say you should be engaged. Well, okay, like you telling your story, Laura, you and your family were engaged. The Batz guide to me, for our audience that knows about lean, to me it seems like it's standardized work. It gives more specifics about what you should ask and when. It doesn't. I mean, for everyone who says every patient and every scenario is unique, well, sure, but it seems like the Batz guide is designed to be a framework that's helpful. It can't address every single situation, but boy, it seems like it's designed to catch most, to help catch most everything, or the most common scenarios, would you say?
Right. Yeah. I mean, in the guide, when you look at it, I mean, these are evidence-based proof issues that hospital deals with: falls, infections, medication errors, blood issues, things like that. So these are things that, when you do look at the preventable medical errors that happen, these are the certain things that seems to fall into those categories kind of all the time. And, my mom's case, is really a medication issue. So, I mean, that's probably what I would be driving towards looking at. But, I mean, then there's things on falls, infections, bed sore, all these things that, need to be addressed. And how do we help the family? How do we help the healthcare team? And how do we become part of that team? Because, like I said, every single day, I didn't want to be on the A team, because I was not one of my family members that went to medical school for 8 years to do this. But I could have been on the B team. I could have come off that bench and made that 3-point play, because nobody knew my mom like I did. Or herself. Nobody knew her like that, and I could have been an effective member of that team. And that's what the guide does. It helps you to be an effective member of the team and be that, come off the bench, be that bench player, be part of the team. I wish to God I'd never been sent home, because I didn't even have a chance to try. So.
Yeah. Go ahead.
I think the way I would look at that statement on Elise's slide is that, nurses have a lot of tasks to do, and questions sometimes interrupt those tasks and might be threatening to nursing staff. But one of the things I think that the Batz guide does, and that some of the questions do, is help clarify for the staff and the patients how the system is working to keep them safe. So I'm putting on a pulse oximeter, you know, for the nurse to really recognize that task is to help protect patients who are on narcotics, make sure that they're, or not on narcotics, to make sure that their oxygen levels are adequate. You know, as a caregiver, I might just do it, and I might not even be that cognizant of why I'm doing a lot of things, but the guides help focus everybody on the why of all the tasks, and then the explanation just becomes part of your work.
Yeah, and I think that's a great lean lesson, the power of explaining why instead of just telling people to do something because we said so. I think that's really powerful. One other easily answered question: can we download the guide somewhere? So yes, go to louisebatz.org. You'll find links for PDF versions of the guides. You can go on the Apple App Store, and you can find the app there if you search for Batz Guide.
And the Android as well, yeah.
I'm sorry?
And Android as well.
And Android, okay.
Yeah, the Batz patient guide. And then, of course, you can always email me and we can mail you a guide, or if you're interested in using it in your facilities and stuff, we can send you some.
Yeah, because I think the PDF guide is the best way for someone to kind of scroll through and look at it. But yeah, to get the paper guide, I hope people will reach out because they're interested in that. And I'll tell you, I was at a hospital here in the Dallas area on Monday. I gave one of the Batz guides to the chief nursing officer and introduced just a little bit about it, and she started flipping through and she thought it was fantastic. So she was really excited to go kind of dig into the guide, and I hope that will lead to the type of structured, systematic adoption that you've all talked about today. That partnership, I think that's really really important. So I want to thank everybody for dialing in and attending today. Certainly want to thank our presenters, Laura, Elise, and Carol. Thank you so much for sharing a little bit about your work and hopefully inspiring a lot more improvement. We'll spread these methods, we'll spread improvement all throughout healthcare. So on behalf of the entire team here at KaiNexus, thank you for joining us, and I hope you'll join us again on September 21st. Have a great day.